you're gonna need to find a happy medium, what I'm saying here, as you start to do your clinical time. You should not be doing anything in the hospital that you are not trained to do, or that you're not ready to do. So you'll have to do a little bit of self-assessment on that, because at the same time, we don't want to inhibit you from having an opportunity to do something in the hospital that would be really cool. But do be aware that those are all real people, and you all listen to Dr. Dan. Right? So make sure that you are competent at whatever it is that you are about to attempt, and that it is something that is A, within your scope, and B, appropriate to do. I'm not having any problems right now, but at the same time, every once in a while you'll have a doctor or nurse who doesn't quite know what you can and can't do. And sometimes when that happens, they ask you to do more than you really should probably be doing. Sometimes they don't ask you to do enough. So fight for your need to be doing more, while at the same time don't go too far. Sound good? Yeah.
Could you give examples of what would be going too far?
Yeah, probably you shouldn't be doing any crikes, because you just haven't practiced that enough yet, right? But at the same time, if you've got a doctor sitting right there and he or she knows exactly where you are on everything and is directing you, that's something different, right? You should not be intubating anybody without a doctor present at this point, right? So if you are in the hospital and they say, hey, go to room 5 and intubate that patient, probably you shouldn't be doing that unless the physician's actually there, or an anesthesiologist or somebody's actually there to be able to watch that, because it'll be the first time you've done it on patients, and you haven't done any OR time, which is when you're actually getting the true practice of doing that on a real person. So just keep that in mind. Sound good?
Uh-huh.
You'll have to be careful when it comes to some of those things.
Pushing drugs that are out of our scope?
Pushing your drugs, so there is no drug that's out of your scope.
Okay.
There is no drug that's out of your scope as long as you have a doctor's order to provide that drug. So there are drugs that are directly in your scope because there are specific drugs that are gospel drugs. There's a line item in your scope that says push any drug that a medical physician provides orders for you to do. So there is no drug that's out of your scope, but at the same time, once again, use that with a grain of salt, right? If they're telling you to go, hey, get some insulin started on that patient in there, maybe you should think twice about that, because it's not a common drug for us to do. And you'd want to make sure that you have direct supervision to make sure that's being done properly. Right. Good?
And we shouldn't be doing any, what about IVs without nurses present?
Yeah, that's a good question. I mean, in the true ideal world, you're supposed to have a preceptor that's watching things like that, but that's also one of those skills that is given a lot of leeway to. It's very similar to doing blood pressures for an ENT, right? It's a standard part of your job. You've had a lot of practice on it. You've been doing a lot of skills on it. I'm not as worried about that as I would be some of these other ones. Good?
On their side, they might be more worried, but not.
True.
I've had a few nurses tell me.
I would very much rather you be with nurses and physicians than with ER techs and such. And that's a constant battle for us for these level of hospitals. And we are constantly in communication with them saying, you know, we had a nurse that gave our paramedic up to an ER tech, and even though the ER tech is also a paramedic, their hospital scope isn't the same. And so we're constantly trying to keep them on. And most of you found that when you're with a nurse, you get a better experience.
Yeah.
Than when and it's because of the scope of what's happening in the hospital, right?
Mm-hmm.
But we are dealing with level 2 and level 3 hospitals and trauma hospitals, and they don't deal with students. They do deal with students, but they're not trained to deal with students like a level 1 trauma hospital, but we only have 2 of those in the state of Oregon, so. So we make do with what we have.
Yep.
But do the best you can to stick with the nurses, which means don't tick them off, and help them as much as possible. so that they want to be with you, would be your best bet. The more frustrating you make it for them, the more they don't want to be with you, the harder it is for them to take you on and give you good experiences. Good? Questions there? Fantastic. I'm gonna sound like a broken record. I told you I was gonna sound like a broken record, but some of you are starting to feel the effects of it. So when it comes to practicing and open labs and stuff, even outside of open labs, when you're practicing, you need to treat that every bit as a physical skill, right? If you are still in the habit of practicing assessments by reading your skill sheet or talking it through with somebody, that is not gonna cut it. You've gotta be physically doing it and physically making it an activity that you are building your muscle memory on. So even if you're not here and you're at home practicing, you need to be not just reading it, but actually doing it. Good? Whatever that means. Yes?
I have a question about that for the BizDoc sign-off.
Yeah?
So like, when you are doing, intubation, you can get X number of intubation skills that you just practice, but for trauma assessment or medical assessment, there's so much in there, and not every time you do it are you gonna practice all of those things. How do you want us to document those?
Give me an example.
So like, you could do an asthma assessment, but you're not gonna go into any, you're not gonna do your cardiac algorithms on that particular assessment.
That's true, you wouldn't have to do your algorithms, those would be NAs, because you're not
Okay.
doing them. So you just,
Okay.
so you'd have to make sure that you are doing enough different types of scenarios to make sure that you're accounting for that.
Okay.
You should be practicing many different types of scenarios.
Right. I'm gonna figure out a better way to ask this question,
Okay,
and then ask it at a different point in time.
sounds
so.
good. Other questions? Stay healthy. Don't get sick.
Yeah, no.
I'm trying.
Just saying. Okay, so we